Now we have news on the limo driver, the man believed to be patient zero. For the past 2 days, reporter Lauren Goldman's been speaking to the man and his family on the phone. Now, Lauren is currently at home as she's feeling unwell. She's had a COVID test which came back negative. I spoke to her a short time ago. Lauren, this limo driver is the man in the hot seat really at the moment. He's copped quite a lot of criticism about his involvement in this latest outbreak. How is he coping with that criticism?
He actually wanted to come on and talk and speak for himself and clear his name himself, he says, but he's not feeling up to it just yet. He's not feeling well enough to do so. He's also really scared and concerned. He's obviously been receiving a lot of criticism and he's worried about his safety and his family's safety.
Let's talk about some of the criticism he's copped, and it's not entirely clear exactly what he did right and what he did wrong through all of this because we're not getting the detail from New South Wales Health. But he wasn't vaccinated. Why wasn't he vaccinated?
The driver admits he is not vaccinated. He tells me that's because he's over the age of 60 years old, which means he is eligible for the AstraZeneca vaccine. He tells me he has a family history of blood clots and he didn't feel comfortable getting this vaccine. He says he has been working with his doctor. They talk regularly and they're trying to come up with some sort of plan. But at this stage, he's too afraid to have the AstraZeneca vaccine.
Surely his doctor would have known that he or she could recommend this driver for an exemption to get Pfizer. I mean, I'm sure that New South Wales Health would have preferred him vaccinated than not vaccinated. Did they explore that?
As far as I know, New South Wales Health have not explored that. Obviously, people are not forced to have the vaccine, although it's strongly recommended, especially for someone in this job. I mean, he is transporting international pilots to and from the airport every day. So why he wasn't vaccinated or why there wasn't a plan B for him is the big question here.
Is he scared of all vaccines, or he's not a vaccine objector, is he? Or is he just scared of AstraZeneca?
No, he's simply scared of the AstraZeneca vaccine due to his family history of blood clots. Why he hasn't explored those options, I don't know. Did
he tell you that his employer had urged him to be vaccinated? Had he come under any sort of pressure or encouragement to do so?
No, he has not received any sort of pressure or encouragement to have the vaccine. I don't think he's even had those conversations with his employer from what he's told me.
OK, I understand. There's also been speculation that he might not have been wearing a mask when he was driving this flight crew. Was he masked?
This is the first question I asked him, plain and simple. Were you following health guidelines? Were you wearing a mask? He claims he was wearing a mask. He was wearing gloves, and he says he's been doing so since the outbreak since the pandemic early last year. So he says he always wears a mask, no matter who's in his car. He wears gloves and he sanitizes his car in between passengers because he wants to look after his own family. He has a wife, he has daughters, he has 3 grandchildren, and he wants to keep everybody safe, not to mention the wider community.
I understand that there is some discrepancy over whether he should have been tested, received a saliva test for COVID on a daily basis while he was doing this work. Did he tell you that he was getting saliva tests for COVID every day?
He was not getting COVID tested, saliva tested every single day. He says, in his words, he was getting frequently tested, but that's not every day. In fact, he was off work on Saturday, the 12th of June, Sunday, the 13th of June, and Monday, the 14th of June. So he was actually off work then, and he did not receive a test during that time. And ultimately, according to New South Wales Health, that's when he spread the disease around his local areas. So the first test he got within those 3 days was on Tuesday, the 15th of June at 6:30 a.m, according to him.
How does he feel about probably being patient zero here?
It's a strange thing, Tracy. He claims he's not patient zero. Despite what we've heard from New South Wales Health, he feels he caught it out and around in his local area. He told me a story about the fact that he was sitting next to a gentleman who looked like he was in his 30s, who was coughing and sneezing. He became worried sitting next to that person, and he thinks he caught it at Bell Cafe in Vaucluse.
So Saturday the 12th of June is when he thinks he got it?
Saturday the 12th of June and Sunday the 13th of June, he visited Bell Cafe, and that's where he thinks he caught the virus.
OK, he's not an epidemiologist and he probably doesn't want to be patient zero. Has anyone from New South Wales Health indicated to him that he might have caught it at the cafe?
No, New South Wales Health believes that he is patient zero
Yes.
in this Sydney outbreak.
Lauren, let me reiterate, because I did tell our viewers before we began this that you are at home, you've been sick, you've had a cough. Out of an abundance of caution, we've had you stay home. You have tested negative for COVID, haven't you?
That's right, I've tested negative for COVID.
Okay, and let's just reiterate, you have had no face-to-face contact with this driver or any of his close contacts or any of his family. All of your conversations have been on the telephone?
That's right. I've never met this driver or his family. I have simply been talking to him over the phone over the past couple of days. We have been communicating back and forth quite a bit, but no, I've not met him face to face.
Thanks, Lauren.
Thanks, Trace.